Hi, I'm Evelyn, and I'm the owner of Ecore Wellness here in Encinitas, California. We're an integrative and regenerative medicine clinic. But first, I want to talk a little bit about the importance of dental work and how important it is in the series of detoxing protocols that we do at Ecore and why we partner with dentists like Dr. Vane. And that comes from my own experience as a Lyme patient. And when I had Lyme disease, one of the layers that needed to be cleared was my dental work and getting rid of all the heavy metals that I had in my mouth from the metal fillings and from the mercury fillings, especially. And you also know that a lot of you that follow us know that I also had thyroid cancer. So I had Lyme disease and thyroid cancer, and having heavy metals in this oral cavity was probably a large contributor. But we had to get rid of the heavy metals. And then with the heavy metals came a lot of biofilms and Lyme bacteria that were actually in my oral cavity as well. And so it's really important. And many of our patients that are coming to us for Lyme disease, autoimmune conditions, mycotoxins, mold, the list can go on and on. This is the oral cavity is an important layer. And I sat in treatment rooms in Lyme clinics with patients that were experiencing the same thing and just heard the craziest stories about what their gums would look like when the dentist got in there and did the work, removing dark, thick, black bacteria and mold from the gum line. And it's so important that you do that as part of a layer that needs to be addressed. We know that it exists now because our functional testing has gotten so much better because we can actually see the same bacteria that are in the oral cavity are present in the gut when we do the proper GI testing. So, everyone out there, this is an important layer and it doesn't happen on a timeline that everyone suggests. So, whether you're making it, doing it before you start a massive detox protocol like us with IV and EBOO and chelation and some other treatments, or whether you're doing it at the end, it needs to be addressed. You cannot heal until you heal your oral cavity.